Today we are going to do a medical licentiate practitioner licensure examination recourse for the previous February March 2023 exam. So we are going to go through everything. So let's start. And you also have to know that this is not the actual exam, so you can go through, you can pause, go through, and we won't be giving you any answers, but we just walk you through the exam, how it came, and some of the questions that we are able to remember. Yeah. So this is what we are covering today. We are going to cover theory and practical. Then we have to know that the medical essential practitioner exam, essential exam, recourse theory, it was covering a total of 150 MCQs. The first section was from surgery, which was from question 1 to 140. Then there was obstetrics and gynecology, which started from 41 to 79. Then internal medicine started from 80 to 109. Then pediatrics 110 to 139. Then mental health and psychiatry from 140 to 150. So that's what we are going to cover today. So the MCQs and the theory part, we are not MCQs and the practical. I'm not going to share with you any answers, but I'll just be giving you more like a depth of what you are supposed to cover, what you are supposed to know, and so that you familiarize yourself with what's likely to come and how they ask questions. Yeah. Because if we were to give you questions, people might start mastering the same things as if they are going to be repeated. So you just have to see what you're supposed to cover and how much you're actually supposed to know. And yeah. Okay, so let's start. And make sure you subscribe and hit the bell notification. So let's start with our first part, which is the surgery recourse theory. So this is our surgery recourse. So the question here. Now question 1. The maximum lidocaine dosage without adrenaline is which one? So you have to pick from whatever these options were given, so just have to pick from. And the argon was that, I think, where I was doing my attachments from, or my correction from, I don't think we even used adrenaline, and I didn't even know the dosage for even without adrenaline. Like, you just don't know anything. Yeah. Okay, then question. The Merkel diverticulum is how long further away from the sickle? Okay, so for some, where it's written something, just remember there was a structure. Now I think we couldn't able to remember exactly what it was, but it was asking the distance between that structure and the Merkel diverticulum. So you have to pick from 10, 20, 30, 40, 60, and there's also another question. Then question 3. What's the percentage of radiopaque stones? So 10%, 20%, 30%, 40%. So which one do you think is what is the percentage? Do you know the percentage here? So this is how the questions were coming. Like, just have to ask you something. If you don't know, you don't know. If you know, you know. There's nothing as you start to think. Okay, so yeah, but there were somewhere you needed to think, but most of them, especially in surgery, most of them were just facts. If you know, you know. You don't, you don't. And then a lady is in a house that's burning for 20 minutes. She's confused and anxious. What is your diagnosis? So air obstruction, inhalation burns, carbon monoxide poisoning, and the other MCQ parts could not be remembered. So this was one of the questions. Then the next question was, name the scoring system for intubation. So A, Gatland classification, MASAP. So like I said, there was something at the end. So MASAP, and there is ASA and Garden classification. So here at least I knew Gatland classification, Garden classification, and ASA. So at least it was easy for elimination method to work. So at least you know that, okay, ASA is used in this and this. Yeah. So because if you don't know the others, you have a difficult time eliminating answers if you don't actually know them. Okay. So 6. So the route of fluid administration in a child with 7% TBSA burns. So a child with 7% burns. So what's the route of fluid administration? Is it oral? Is it IV? Is it IM? Is it B and A? Or there's nothing to give. So such questions. Okay, so blood supply to the ascending colon. So of course there were MCQ parts. So the names of the blood supplies. So A to E. So just pick one. So do you actually know the blood supply to the ascending colon? So if you know, you know. Yeah. Then there was 2 to 3 questions on hiatus hernia, though they couldn't be remembered. So you can just read up on the same hiatus hernia. Okay, so a patient 70% kg, 40% bends, calculate fluid replacement. So of course using the Parkland formula. So I'm sure just have to go through the Parkland formula for it to actually get this. I think this is one of those where you just have to get this one correct. Then there was also a scenario on calculating a GCS. So GCS, make sure your GCS comes in handy. These are some of the questions you're supposed to be getting correct. Then another question: what is the blood supply to the inferior esophagus? So this was the only one which was able to be which was remembered. So but this question is straightforward. So if you know the blood supply to the inferior esophagus, even without the MCQ parts, you can actually just say it's this one. So if you don't, you can just again look it up. Okay, so blood supply to the ileum. Again, do you know the blood supply to the ileum? If you know, you know. Okay, then which of the following would be classically classed avoiding symptom rather than a storage symptom? So among these symptoms here, which one is avoiding symptom? So if you know you're avoiding symptom and your storage symptoms, so which one is avoiding symptom here? So make sure you actually differentiate voiding symptoms and your storage symptoms. Okay, then I think this is the last. As you can see, we have moved to question 40. So it just means that we were not able to remember all the 40 questions from surgery, but we remembered at least the ones we were able to give you an idea of how questions were coming. So this is the last part for the questions of surgery. So saying shoulder tip pain. So is irritation to what? So is the shoulder tip pain irritation to what? So there was the vagus nerve, diaphragm, and the like. So just pick which one you think is the right answer. So we are done with the surgery. Now obstetric part. We started from question 41, and the first question is: when a baby is born, how many hours passes for you to start feeding the baby? 1 hour, 2 hours, 3 hours, 4 hours? If you know, you know. These questions, because like I mean, I never actually studied about it, but now it's your chance now for you to actually even start like such questions even come. Okay, so we move on to the next question. Then question 42: how many hours is the action line away from the alert line? Okay, this one I think if you just imagine your pantograph in your head, if you have a pantograph where you are somewhere, you can just check. Otherwise, if you haven't calculated this again, if you won't know it, because you will just end up guessing. So make sure you know the hours in between those two. Okay, then 44, we have: what is the best method of management of hydatid form more? D and C, suction and curated under general anesthesia. So just pick your best answer here. So again, A, what's the best method? So you find that most of the methods they are there, but which one is the best? So you just have to know this one as well. Then, which is not an indication for surgical management of fibroids? So here we are not able to remember the MCQ parts, but I'll have something to share with you. I will share with you the treatment options of fibroids. So we have conservative treatment and surgical treatments. Then indications, we have when the tumor are small under conservative treatment. Some of the indications for you to do conservative is that when the tumors are small, the diagnosis is certain and there are no symptoms. Then also you can do conservative treatment during pregnancy, or you can also do it near the menopause when there are no symptoms and the tumor is not enlarging. So these are some of the conservative. Then surgical treatment, we have indications such as when the fibroids are causing symptoms. So when they are symptomatic, then when the fibroids are growing rapidly, it's also one of the indications. Or when they are larger than the size of 16 weeks pregnancy. So as in if they are get to be larger than the size of a 16 weeks pregnancy. Then when the diagnosis is in doubt, or when they are likely to complicate a future pregnancy. So I think this one was among the options. So this one was among the options. Even this was among the options. So you are told to pick. Let me go back to pick which one is known to an indication for surgical management. So these are some of the indication, some of the MCQ parts which were there. So but I think this one was somehow confusing, because you might think when the diagnosis is in doubt, how can we start to do surgery? So I'm sure this was the most confusing part on that MCQ section. Okay, so we are done here. So the best method for determining fetal position and presentation. So we have Mauritius, Medved maneuver, we have real pose maneuver and such. So these are some of the questions you're supposed to know. Okay. Then treatment modality for CIN1. So which one is the treatment modality for CIN1? So there's colposcopy, cone biopsy. So just make sure you go through your treatment guide, the treatment guidelines for the CIN, for you to actually know this. Then there is 48, which is what is likely to increase the incidence of multiple pregnancy. There's increased maternal age, bromocriptine use. So make sure you know what are these factors for multiple pregnancy. But here the question was what is likely. So even if you find that there are actually two there which can increase the incidence of multiple pregnancy, as a MCQ question, you have to put which one is most likely. I think that's how I would get this question. Okay. Then earliest sign of chorioamnionitis is maternal tachycardia, fetal distress, fetal bradycardia. So which one is the earliest sign of chorioamnionitis? So make sure I've studied up on chorioamnionitis, because most people just go through the all 6 stations for chorioamnionitis and they assume they know the actual topic. But make sure I read up on chorioamnionitis. Then active phase of labor in prime gravida, 1 centimeter per hour, 2 centimeter per hour, 3 centimeter per hour, 4 centimeter per hour. And this is one of those where you know, or if you don't, you don't. Okay. Then misoprosto is a prostaglandins, and there was a word after prostaglandin. Okay. Oxytocin analog and the other CDE. So you have to know what is misoprosto, as in the actual drug. What is it? So this was a question for you to actually know. So make sure you go through even drugs and everything. Then 52, on uterine contractions, we know that they are mild, moderate, and they are strong. So it's supposed to be strong contractions. So, and also on that, you have to know the number of contractions and how many seconds and in how many minutes. So choose the right choice. So there was a multiple choice question saying, so if they were to put mild, they will put for you the seconds, the number of contractions. So you just have to pick which one is arranged as in correctly. So which one have they arranged in a correct form, in a correct order? So make sure you know the contractions, the seconds, which we say this is for mild, moderate, and this is for strong. Okay. Then the most common symptom in invasive cervical carcinoma is postmenopausal bleeding, intermenstrual bleeding, postcoital bleeding. So just have to know so which one is the most common invasive most common symptom. Okay. Then question 54. So if you want to be answering these questions, you can even be pausing. You pause the video, then you try to maybe find out, especially if maybe you have another gadget, you try to know what is the answer, that at least you get the depth of the exam. So what question 54, what is the full term gestation age in days? So is this 260 days, 270 days, 280 days, 290 days? I think by the time I was reaching to this question, I was tired, so I couldn't even think properly. Otherwise, I try to calculate. You find that after calculating the answer is not there, then you start to assume. So between this and this, which one should I go for? So, but otherwise, if you actually try to find out which one, I think the answer is if you know the answer, you actually see it. They don't need even for you to calculate. If you came across such a question, say the answer is this, unless maybe you didn't come across this question and you start calculating in the exam room, then that's when it will give you problem. But if you came across it, then the answer was there actually. Okay, so there was 4 to 5 questions on postmenopausal breeding. So make sure I study it as a topic. Postmenopausal breeding. Study it. You know what the most common causes. You know what causes what and what symptoms are there. Then there was also 4 to 5 questions on uterine fibroids, and I think uterine fibroids they actually line them like, if let's say this is 56, then 57 fibroids, 58 fibroids, 59 fibroids, 60 fibroids. Like you're just answering uterine fibroids questions. So if you are not good, or you didn't study in depth the uterine fibroids, then of course then it will be bad news for you. Then there was 2 to 3 questions on ovarian cancers. Of course, you have to make sure you go through them. Then there was 1 question on uterine tumor. I think this one it was asking if the uterine tumor. I think I can remember one part A, which was saying they are malignant or something. But yeah, I think I forgot to remember the exact MCQ part. But just make sure you read on uterine tumors. Then the most common cause of APH, placenta previa, placenta abruption, and classified cause. And there was also other options which you are not remember. So just make sure if you studied upon APH, make sure you also know which one is the most common cause of APH. Then question 60, complications of fibroids, except we have necrosis, degeneration, malignance. So which one is not a complication of necrosis, a complication of fibroids? So make sure you know the complications of fibroids. Then strawberry cervix is found in. This is the first time I was actually seeing strawberry cervix. Like there is even something like this. So we just have to actually even know what strawberry cervix is. So these were some of the options which were there: bacterial vaginosis and chlamydia vaginosis. The best method for determining gestation age is LMP only, USG only, which is ultrasound only, then both A and G. Then there are of course other options. So which one is the best method? Okay, we move on to the next. True about EMTCT. So if we say mention mother to child transmission, so there are some questions on EMTCT. I think there are about 2. Yeah, even this. So this is 63. This is 64 now. Again, it was saying true about EMTCT. In a woman with 250,000 viral load, which was checked for 2 weeks before delivery of the baby. So the baby should be started on September immediately. So there were other pointers, other MCQ parts here, or other parts for this question. So you just have to know, you read up on EMTCT and HIV overall, so to say. Okay, and then 65, the treatment of choice for bathroom cysts is marsupialization, aspiration, observe, curate and close. Okay, E was not remembered, so just know that there was also E. So which one is the treatment of choice for bathroom cysts? So such questions. So if you know the treatment of choice, the best or the treatment of choice, you can actually just, without wasting time, just pick and you move on. Okay, then 79. So I think this is the last question for obstetrics and gynecology because then using an imaginary O clock, the ischiospines are located at 6 and 12 o'clock, 8 and 14 o'clock, and there are also other options here, but I think this is the last question on obs and gyn. But make sure you just read up on this, because I think this was my first time even seeing that you can actually use an imaginary clock to locate the ischiospines. But you have another chance to actually see, and you actually increase your knowledge on these things. Okay, so I think we are done here on okay, so if you haven't subscribed, please subscribe and hit the bell notification, and make sure you like this video and share to people who are in their final years, medical residency final years, and also for medical students, since those in final years, since the practical, of course, we wrote the same one. So practical is practical, so you can just refer to them and tell them about the practical, which is here, which is just the same one they are seeing as wrote. Okay, so internal medicine. Let's start. I think this was the internal medicine had questions which were difficult. I think it was most difficult for me. I would say it was the most difficult because I didn't even know how many questions I actually had correct. Because I certainly didn't know this one because it's my first time seeing Christmas disease. Okay, I'm sure maybe some of you have seen it. Okay, if you have seen it, well, that's nice for you. Otherwise, okay, so we begin. Which disease is known as Christmas disease? So is it hemophilia A, B, C, or idiopathic thrombocytopenic purpura? Okay, so if you know, you know this question. Then a 53-year-old non-diabetic patient present with lethargy, RBS 900 milligrams per deciliter. What is the cause of his state? And as you can see, there is lethargy there, and they also, I think it wasn't included, but I think he even went into some coma, and I think he regained some consciousness. If I'm not mistaken, it was a big scenario. It was a big scenario. Other lab findings and scenario parts can't be fully remembered, but there was no ketones in the lab findings. So of course, it even gives you an idea to say this patient was in this condition, or in this crisis, or in this complication. Okay, 82. Uh, Patient blood microscopy shows microcytic anemia picture. So then there's the positive secretin test, and we also unsure about this statement. So the statement of being a positive secretin test. So is it iron deficiency? Is it anemia of chronic disease? Is it pernicious anemia? So here, if you know the causes of macrocytic anemia and you know the causes of microcytic anemia, you can actually just rule out the one for micro, then you remain with the one for macro, then you actually know which one is causing which one is which. Okay, then 83, a patient with 2 weeks fever, MPS negative, FBC shows anemia. Which one is it? Is malaria? Is it enteric fever? Then there are of course others. So these were such questions which were coming. So 2 weeks fever, MPS negative, you know that okay, definitely it's not malaria then. Okay, but it could be, but definitely not. In this case, I was pretty sure it wasn't. Yeah, but I don't know what you think. Don't know what about you. Then, it's 4, antibiotics, diarrhea, asking like what happens, pathophysiology choices, pick the correct ones. Inflammation of the so here it was more like they were talking about pseudomembranous colitis, which is the antibiotics diarrhea. Then they put the pathophysiology as in the MCQs. They were putting the pathophysiology as in. So I have to pick which one is the pathophysiology for. So the membranous colitis, or the antibiotics diarrhea in layman, so to say. So make sure I know the membranous colitis. Then fluid of choice in DKA. This 0.9% NS. Is it Atman's solution? Is it dextrose? So if you know, you know. If you don't, you don't. And if you've seen other people in the world like I did when I was a student, we used to see other people using, some use this and other use this. So here, so you yourself have to know which one is the correct one. Even if you see other people doing wrong things, you have to know which one is the correct one to use. So fluid of choice in DK, which one is the fluid of choice here? Okay, then which one is true about acute leukemias? So I think CEOs remember say acute lymphoblastic leukemias is the commonest childhood tumor. Then there was also another one to say commonly present with generalized lymphadenopathy. Okay, so these were some of the things which were brought. So make sure I read up on your acute leukemias. Then 87, investigations of choice for hypertrophic pyloric stenosis. So studied upon pyroric stenosis, and of course you have to remember the investigations of choice. Okay, then a scenario on calculating a GCS. So I think this was the second question, the same exam. The, such that there was a question to calculate GCS and also internal medicine. So bearing this in mind, let me just even just let us just go through. You just go through this Glasgow coma scale. Okay, so we know that there are parameters that we have: eye opening response, verbal response, and motor response, and together they make up 15 points. So on eye opening, when there is no response, it's 1 point. When they are opening the eyes to pain only, and this should not be applied to face, it's 2 points. And if they are opening to verbal stimuli, command, speech, it's 3 points. Then if they are spontaneous, they are opening with blinking at baseline, that's 4 points. That's the highest. Then you have verbal response. So if they are not responding, which is no response, it's 1. Incomprehensible sounds or incomprehensible speech, it's 2 points. Inappropriate words, 3 points. I think this one was there in the previous part. That patient had inappropriate words, so I'm sure. And then so for 4 points, it's confused conversation but able to answer questions, which is disoriented. The patient is disoriented or confused, that's 4 points. Then oriented, that's 5 points. Then for motor response, which is a total of 6, no response 1. Abnormal extension response in response to pain, it is decerebrate posturing, that's 2 points. The inflection in response to pain or decorticate posturing, that's 3 points. Then withdraws in response to pain, that's 4 points. Or purposeful movement to painful stimuli or localizes pain, that's 5 points. Then obeys command for movement, that's 6 points. Or obeys 2 parts commands. Okay, so at least you now have ideas once again on the GCS in case you forgot. Then there also this question say, in dermatology, coin-shaped deformities are called what? So if you know, you know. And if you have never passed through dermatology, at least you should just read down the revision for the whole dermatology, because these are subspecialties in internal medicine, and you have to know whether you are a medical licentiate, you are a doctor, a clinical officer. These are some of the things you are supposed to know as subspecialties. So this called mobiliform, this called retinoid. So if you know this one, you know. Then question 90. Protein from pleural fluid analysis at 50 gram per deciliter. What is the cause? So is it heart failure? Is it nephrotic syndrome? Is it pneumonia? Is it pulmonary infection? So here, if you use your rights criteria, you know that under the rights criteria, if you have just one for exudate, then it means the causative is not a transudate one. So this analysis for proteins, it is more than 30 grams per liter. So of course you know that, okay, now this is this. So at least I've even explained something here. Okay, so make sure you use your rights criteria here and know that, okay, it's more than 30 grams, so that gives you a exudative cause. So just pick which an exudative cause for pleural fluid or pleural effusion, so to say. Okay. Then 91, commonest source of thrombus in pulmonary embolism. Is it the thigh and legs? Is it the jugular? And these ones we don't remember. So if you know the commonest source, then of course I think this you can get this one correct. Then 92, what is the percentage of water in the human body? Is it 50, 60, 70, 40, 80? So which one is the percentage? If you know, you know. But I'm sure I know. But what's the percentage? Well, this percentage of water, let me check. Percentage of water in the human body, percentage of water in the human body. Okay. This is the same question, I think. And there were some questions which were cancelled out in the internal medicine, and I think the question which was cancelled out for me was the only one I knew. Okay, this one I can get correct. It was asking about the drugs you use in TB, I think, if I'm not mistaken. And unfortunately, we were told to cancel out that one, and it was the only one I was sure of I was going to get correct. Yeah, so we are done with internal medicine. Let's go to pediatrics. So theory recalls. So pediatrics started from 110. So a question on a question on HIV, where a woman gave birth to a child that later developed difficulties in breathing, etc. Then the mother had a very high viral load, probably 250,000. So don't remember properly. But one of the MCQ part was PJP, and so you just have to know, read up on HIV, like I said, and I'm pretty sure the reason why I remembered PJP, I think it was the answer I went for. Yeah, but I'm not saying it was the answer. I'm just giving a point that say no, there's no such conditions in for HIV and also in children. Okay, then what is not found on the resuscitation table? So is the laryngoscope, is the penguin sucker, is the ambi bag plus mask, is the oxygen source. So this one was one of the questions where you have never read about it, but you have actually seen it. Now, which one here is not found? Is not found on the resuscitation table, and you just have to pick one. Make sure you pick which one is not found on the resuscitation table, and feel free to drop your answers in the comment sections. There, you can drop your which one do you think your answers, so that you leave it for your for the viewers, other viewers who are able to see that they say, okay, my friend answered this. What about me? Okay, so diabetes can cause these, except so diabetes can cause these except meconium aspiration syndrome, Down syndrome, and there are also other parts. So which one can't be caused by diabetes? Okay, this is PID, so bear that in mind. Then the cyanosis is seen the least in. So cyanosis is in the least in respiratory distress, hypoglycemia, congenital heart disease. So cyanosis is in the least in which condition? And I think this question, if I remember correctly, it was repeated twice. So if you knew it, then you know, okay, I have two marks already. Then 114, true about a child with lethargy, very sunken eyes, and skin pitch that goes back very slowly. A, give plan A. Plan B, the child has severe dehydration, give ORIs. And I think this was somehow, I think I read this more than 3 times because I couldn't find it. Were they asking me to manage this child, or they just wanted the statement which is true about this child? So I think you can just go through and pick one which is true, because the answer is amongst the choices given there. Okay, so someone comes with hypoglycemia. So what are you going to do? Are you going to do the LFTs, serum glucose, and the like? So this one was, I think, unless maybe you start to overthink, but you can just go for the one you know. How many calories are found in F100? So again, here, if you actually know, and you have I don't know, I don't want to say mastered, but let me just say, if you know how many calories are found in F100, this was easy. Then also there was okay, so this is our 39, but not our actual 39, but depicting that we are now ending the PIDS recalls theory. So how many proteins are found in F75? So this is also amongst the questions which were there. So how many proteins are found in F75? If you know, you know. Okay, so we are done with PIDS. So this is now mental health and psychiatry recalls theory. So 140. You are asked to immediately resuscitate a patient who has been brought to the emergency room with opioid poisoning. He is in a state of profound respiratory distress. Which of the following drugs should you choose to administer to bring his breathing back to normal? Is it Framazineo? Is it Naloxone? Is it pentazocine? Is it amitriptyline? Sorry about the pronunciation. They are very bad. Yeah, today. Yeah, so which one do you think is the answer? Which one should we actually use? You can pause the video and read it again, you analyze, and then maybe you even try to find out. Okay, but here we move. This now you have ideas. Okay, so then the other question was a 22-year-old a 22-year-old. I don't know if it's a single man or what, but yeah, they were brought by his family members with complaints of suspiciousness, sudden onset of suspiciousness. So that's the presenting complaint on his family members. So he's suspicious on his family members and also on his neighbors as well. He had stopped consuming home cooked food, thinking that it was poisoned. He also had restlessness and decreased sleep. The diagnosis in this case is A. Acute mania, B. Acute psychosis, C. Delirium, D. Depression. So which one do you think is the answer? E. Yeah. Such questions for mental health, for MHP, mental health and psychiatry. Then also this one, we had a 28-year-old male presents to emergency department with symptoms of decreased sleep, palpitations, fearfulness. On examination, the patient has tremors, the BP of 140/90, the pulse rate of 98 per minute, and the patient attendee says that he takes alcohol since 10 years and last drink was 1 day before. All are true about the management of this case, except all are true about the management of this patient, except, so which one is not true? So to check for RBS, to give IV dextrose followed by injection of thiamine, or to give injection thiamine and IV dextrose, or to give IV lorazepam. So which one is not true among what I've mentioned? Okay, so make sure you pause and maybe you analyze. Otherwise, we are moving on to the next question. Then someone comes to you within OPD with history of suicidal attempts. You are going to give, so A, give aminophylline. Is it aminophylline? No, I think, sorry, this was supposed to give amino this. Let me just go and show you the drug so that you don't get confused. So it was this drug here on D, aminotriptyline. So give aminotriptyline in the morning and evening. Then B, refer to psychiatry. Then C, electroconvulsive therapy. Then D, all of the above. So someone with suicidal attempts, which one am I going to choose here? Okay, we move on to the next 144. When doing a procedure without when doing a procedure without getting consent. So what does it mean when we're doing a procedure without so you can just not mind this part. So when doing a procedure without getting consent, is this ethically acceptable? Or the question is supposed to be doing a procedure without getting consent is. So there was is. So when doing a procedure without consent is ethically accepted, ethically unacceptable, ethically not defined, all of the above. So when you are doing a procedure without getting consent, what is it? Then 145, a question about a woman who gave birth and 12 days later developed mood swings, anxiety, etc. So is it postpartum psychosis, postpartum depression, or postpartum blues? So what do you think it is? Then this was the last part, our last part for us for theory. That is, so a triad of Wernicke's encephalopathy includes or except A, third person hallucination, B, confusion, C, ataxia, then D, sixth nerve palsy. So which one is not found in the triad of Wernicke's encephalopathy? Okay, that's the end of theory. So Let's now start with practical. So there are 14 stations with 2 rest stations in between. So as we are going to start with first station 14, so since we like resting, so if you start with rest first, then we begin work. So station 1, a woman vomiting blood, ask her a relevant history. So there's a woman in front of you and the examiner, then they told you the presenting complaint is vomiting, she was vomiting blood, ask her a relevant history. Then uh, then in your way, when we were asking history, then she also mentioned, if I'm not mistaken, that she also had some hearing of eyes. So when we are asking questions, you have to know how to ask for hemostasis, for jaundice. I mean, not sure I know which questions to ask. Then after that, questions followed after were causes. So we asked the causes, but this depends on you, your experience with what you are doing. Because if it's time up and you are just asking the history, then of course they won't ask you questions, it will just be time up for you, you move on to the next station. So if you are done with the history, then of course they are going to ask you questions, and they won't just ask you causes. If let's say maybe there is more time, maybe they just ask you maybe even the management. But if you are slow in taking the history, by the time they ask you a question, they even just end up on asking you the cause, then it's time up, you move on to the next part. But so it was depending on the person and how fast they are and how they were answering questions. Okay, so at least you have now ideas. So station 2, abdominal examination on a patient with acute abdomen. So a real patient with acute abdomen is there. They tell you that he has acute abdomen. Then demonstrate your abdominal examination. So if you're still if you're a student still in the wards, make sure you practice these examinations, because so that you get that fear of the examiner, or fear of you doing an examination out of your mind. Though it's going to be completely there, but at least you get used to being examined by other people, so you won't be shaking whilst you are doing examination. And also, what the other thing what the examiner told me was that I should be giving out the findings, like after you do percussion on the abdomen, they then ask, so what is your finding on percussion, what's your finding on palpation. So don't just know that it's palpation and percussion, know even the findings and where are the findings. Okay, so station 3, uh getting get signed consent on a patient with thyroid cancer scheduled for thyroidectomy, and address her concerns. So you have to know how to get a signed consent. And if you are still a student, make sure you, when they, especially those in surgery, they are the ones, surgery and OBGYN, if I'm not mistaken. By other departments, I think that's where I just got some signed consent when I was a student, surgery and OBGYN. So make sure you practice how to get signed consent from patients, because, and of course, for you to get signed consent on patient, you also have to know this the same topic, thyroid cancer and thyroidectomy, because our concerns would be the complications. Because that woman, uh, from what I could tell, they gave her pointers. So because she even used to ask, like, some of the complications such as hemorrhage, she tell you about, okay, if there's a complication hemorrhage, so how are you going to manage that if it occurs? So you are thinking just getting side consent. Now she has asked you how to manage hemorrhoids. If post-operative, if there's hemorrhage, how are you going to manage her? Or if there is injury to the recurrent laryngeal nerve, or if she stops talking, how are you going to manage her? So those are some of their of our concerns. But bear in mind that you have been told to get signed consent, so don't stray away from your objective. Okay, so section 4, demonstrate how to do a lumbar puncture. So make sure you are fast. Then after you are demonstrating lumbar puncture, you have to do a lumbar puncture. Questions were followed, indications, contraindications, and I'm sure depending on how fast you are, I think they can even move away from even contraindications. They ask you also other things. Yeah, but otherwise, these are some of the, and also when saying indications, maybe just a knowledge tip as usual. I think the examiner was happy when I mentioned they are diagnostic and therapeutic. Yeah, So, but just that, even if he was happy like that, he wasn't happy with the answers I started giving in between those. Like you start well with how the indications are classified, then again you start saying wrong things on the actual indications. Okay, just make sure you don't do that. Yeah. So that's how it is. Yeah, then contraindications I heard from also from other people who are recording what they were being asked. So if they say uh low platelets, so they ask you how many to be specific. So less than what, or how many is low, because is it 140, is it like low platelets? So what is the low platelets? So that's what he meant. Yeah. So then there was also a question on so a child with nosebleed. So what's the medical term for this? Which is epistaxis. Then causes of epistaxis, investigations you can do. Then though the pictures are where I couldn't add everything, because I think I remembered, but I just couldn't just add the other pictures. So they added two other pictures. The first picture was, what do you see on the, I think the child, they gave a picture for the legs of the child, and there was like breathing under the skin and other things, and there was ecmosis on the legs. So not that there was, it was indicated as there was ecmosis, but the examiner asked, like, what's the name of the, what do you call bleeding under the skin? For this was just happened for other people, but for others they were just told to interpret for themselves. They were not even asked to say, okay, so what do you call bleeding under the skin? Then you say ecmosis. Yeah, but apparently there was ecmosis on the legs. Then second picture, it was the blood smear. So what do you see? For others they were told to interpret the blood smear, they say what they see, but others were just told, after they give you the blood smear, then they just ask you the diagnosis. Yeah. Then also management of the patient. So how do you manage epistaxis? So yeah, make sure you know these things. Okay, station 6, a case study of a woman with PV bleeding, false maiden discharge. LMP was 8 weeks ago. Then the pregnancy test was positive 2 weeks ago. Then this was an unmanned station, so there was no patient, an actual patient there. It was supposed, you were supposed to write answers on a paper provided. So the question was initial management for this woman, and some of the things I missed was the temperature. The temperature was very high. Yeah, and I've forgotten the blood pressure, but yeah, she was also, the blood pressure was also very low. She was hypotensive. There was hypotension there, and the question was the initial management. So of course you have to manage her like that. Then differentials for, though the question was what is your differential, so it didn't put put differentials or differential one. So yeah, so it's confusing. But otherwise, yeah, so I think it confused me, so I just ended up putting differentials instead of a differential. But otherwise, yeah, management after the initial management. So of course you are not supposed to put a definitive management on your initial. You are supposed to put your definitive here, and they said with a statement, what is your management after this initial management. So you start with your statement. So don't just say the definitive, start with a statement. Say, okay, this and this, we are going to do this. I think that's all on this station. We move on to the next one, which is station 7, which was a rest station for us. Then station 8, so this was the man, so I mean there was a woman with right iliac fossa pain. So ask her relevant history. Then after you're done with asking history, the questions we are following, depending on your answers, of course, what are your differential diagnoses? So if you say appendicitis, ask, the examiner will ask you signs and symptoms of appendicitis. And further history, let's say if you said appendicitis, then you left out some necessary history, you can ask on appendicitis. They will tell you what further history if it was appendicitis. Same with ectopic pregnancy. History if it was ectopic pregnancy, what questions can you ask her? Signs and symptoms, of course, don't forget the triad of both the ectopic pregnancy. Yeah. Then if you say PID, history photos PID. What can you ask? What are the signs and symptoms of PID? So that's how the examiners were moving, depending on your answers. Not that, yeah. So depending on what you have answered them, yeah. Okay. Then so station 9, identify what you see. Identify what you see on the chair. Then, of course, on the chair there's an nasogastric tube (NGT) and a lubricant. Then they ask what are the indications. Then after you mention the indications, they ask you contraindications. Then also there was also another table. There was this X-ray. So what's wrong with the X-ray on the other table? So you take a look at the other table. Then there was this X-ray. You get it, and you see there was this thing coming here and passing here. So they ask you what's wrong with this X-ray. So you can pause the video and assess what's wrong with this X-ray. Then after you mention what's wrong with this X-ray, so and this was being done, I think maybe it was 5 minutes. So after you do that, then the last part was demonstrate how to insert an NGT. So there was a dummy, which is an infant dummy, so to say. So demonstrate how to insert NGT. Demonstrate how to insert NGT. Insert how to insert NGT. So after we demonstrate and the like, I think depending on where time will end for you, maybe I don't know what followed, but for others, time was ending on after demonstrating, and that was the end of that station. Then station 10, a woman with long history of smoking has now been confirmed with a long mass. With a lying mass. After taking a biopsy, they are showed specifically a squamous cell carcinoma. So she has a lung cancer. So how will you deliver the news and tell her about the treatment available and address her concerns? So this was the question. So you have to know how to break bad news. So I think I made the video on breaking bad news. I'll share a link on top. Then I'll share a card on top here. Just check on top. I'll share a card on how to break bad news. Then also on top of that, you also now have to address her concerns. Like, she used to ask, like, am I going to die? What should I tell my family? So you have to know how to break bad news, because everything, I think specifically I put the lung cancer case in the breaking bad news tutorial video. So just check on it. Then question station 11, Partograph. So this was also unmanned, so you're supposed to write answers on the provided paper. So identify drugs. So there are some drugs on the Partograph, you have to identify them. Also actions taken at specified interval. So know how to interpret a Partograph, and also know abbreviations on a Partograph for you to answer, because let's say if there is ARM, what's ARM? If there is C, if there is B, those abbreviations or initials, you have to know them. Then findings that T is equal to 10, so that was time. Then it was written, there was this abbreviation MEC2. Again, no abbreviations involved on a Partograph, but I'm sure this was meconium grade 2. Yeah. Then what final action are you going to take? Know how to properly interpret and what actions to take. So after you analyze this Partograph which was given, and so you are told to actually take, what action are you going to take? Yeah. Okay, station 12, a picture of a baby with a high flow nasal cannula. So there's this baby and there's these things. So the examiner, depending again on how the examiner was, so for me, so to say, the examiner explained the appearance of the machine this thing was attached to, and asked the name of the machine. So they asked the name of the machine. So the machine was the CPAP. So they say, what does it stand for? What does CPAP stand for? What are the indications for you to actually use the CPAP? What are the contraindications of using a CPAP? Then the mode of action. So here on the mode of action, I think this question, from the word mode of action, I thought maybe I don't know what the mode of action is, so I just said, no, I'm not sure on that one. Then unfortunately the examiner tried by all means to make me understand how the question, so he changed to say how it works. I still couldn't understand. I said, no, I'm not sure. I don't want to lie. Then again, he said, okay, what does it do to the lungs? Then that's when yeah, it does this and this. Then you said like, yeah, right. That's what it does. So that's how it is in the practical exam. So it just depends on how you and the examiner and how you are answered in questions and how the questions are flowing. So and also of course your attitude is so make sure even your attitude is it's good, so to say. Then the last question was complications of you doing of you after this CPAP, complications of the CPAP. So though I didn't know this, so there are other complications for during initiation, also during news and the like. So those are some of the things you are supposed to know. Then station 13, unmanned, write answers on a paper provided. So write down uses of A to C. They were named. So I think you are not even supposed to name this. Just write down A assesses for this. B, this is B, assess for this. C, assess for this. You are done. Then the last part was write down the name of the fourth maneuver and its use, or what does it assess for. So as you can see here, this was confusing because a lot of people have seen this picture somewhere, and this C is not their actual C which they see on that picture. So when this question was like name the fourth maneuver, most people ended up writing the same C, which is A. So make sure I don't master the letters like A, B, C. Know how this was done, and of course this person who was examining here was supposed to be on the right side, so it was even indicated down to say not the patient examining this patient was supposed to be on the right side. So you have to know what is involved. This hand is here, so which maneuver is this hand? The hands are this side, which maneuver is this? Then the hands are this side, which maneuver is this? And looking at the way these three have been named, which one could be the fourth maneuver which is not here? And also in other books, though I won't give an answer, but I'll tell you, in other books this same maneuver here is called the first pelvic maneuver, then the one which is D is called the second pelvic maneuver. So I think that's what I even came to realize, to say okay, C would be the first pelvic maneuver, but it has its name as well. Then D is this maneuver, and it's this, which is the second pelvic maneuver. So make sure you don't master the letter, just know where hands are placed on each maneuver. So if it's this maneuver, the hands are here, hands are here, hands are here. That's how you have to know this thing. Don't master, but even though they say there's no mastering without knowing, but after you master, make sure you know things. I think that was the end of the practical exam. Okay, so thank you for watching, and make sure I subscribe. Make sure if you have, so the practical exam was probably the same with the medical doctor, so I'm sure you can share with your medical students, your medical licentiates, because especially for the medical licentiate, the exam was over, our performance was poor overall. So we don't know why, but they just share to people who are in their final years or who are soon to write their licensure, who are preparing to write their next licensure exam. Otherwise, this is the end of the tutorial video.